So in chapter 2, we talk about in the book medical social work practice, law and ethics. This chapter is really important, I believe, because it really addresses the importance of medical social workers really being well versed in the laws and ethics as it pertains to healthcare. In many situations, social workers are definitely the frontline staff in a hospital setting to come and have a discussion around law and ethics within a hospital as it relates to the patient. So it's very important that you are aware of the hospital policies, of the federal laws regarding perhaps HIPAA, protected health information. This is something that you definitely are going to definitely want to make sure that you are aware of. In addition, it's very valuable as a medical social worker to understand the different laws that may be related to like your clients that you're working or your patients that you're seeing. Perhaps if you work in a older unit, a geriatric unit, and your clients are on conservatorship or they need to be conserved, understanding the laws around conservatorship is so important in a hospital setting. In addition, if you work in a maternal child or pediatric unit, it's so important for you to understand the child welfare laws. I'll give an example. When I worked in the hospital, it was important for me to know like what are the age limitation. Like if I get a teen mom, I need to understand if her boyfriend is like a certain age and she's a certain age, that there's a law that protects that teen mom and a report should be made if the law is being violated. And for many social workers that I've came across, they really weren't very well versed in the child welfare laws and understanding that dynamic. In addition to child abuse reporting, it's so important for us to understand the child abuse reporting laws, especially if you work in a pediatric unit and in a maternal child unit. But it's also important if you work in a medical surge unit. An example of that is if you have a domestic violence situation where a patient comes in and was, really beaten up or whatever the case may be, and you understand that the couple has children. It's important for you to understand that if children was involved in hearing or seeing, that a child abuse report needs to be generated. So it's things like that that you're going to learn in this chapter about the importance of law and ethics and really how you can go about and understand the different dynamics of that. As a social worker, many times you're going to definitely be the person that they're going to call and reach out to facilitate ethics committee meetings and or even referring something over to the lawyers of the county that you work for or the administration that you work for that might need to kind of get more information about a patient that might have some legal situation. Understanding who's the power of attorney for your patient is important. You're going to be faced with several different scenarios that you really are going to have to understand the law and ethics as it pertains to working in healthcare.